Many older adults believe that a daily shower is the only way to stay clean, but for aging skin, that habit can quietly do more harm than good. As we grow older, our skin thins, dries, and repairs itself more slowly. Hot water, strong soaps, and frequent showers can strip away the natural oils that are left, leaving the skin itchy, cracked, and vulnerable to infection. At the same time, the bathroom becomes one of the most dangerous rooms in the home because of slips, dizziness, and sudden drops in blood pressure. So when we ask how often seniors should shower, the shocking truth is this. There is no single number that fits everyone, and for many older adults, the right answer is less often than they have been told, but with much better technique and daily targeted washing. Before we go deeper into this, take a moment to subscribe so you stay close to every lesson that protects long-term health and independence for you and for the older adults you care about. As the body ages, the rules of bathing change because the skin and circulation are no longer the same as they were at 30. With age, the outer layer of skin becomes thinner, oil glands are less active, and the skin holds less natural moisture. This dryness has a medical name, which is xerosis, and it is especially common on the shins, forearms, and hands in older adults. When dryness is severe, the skin can crack into tiny fissures, a pattern sometimes called osteotic dermatitis. These cracks sting, itch, and open the door to infection. Geriatric skin researchers describe how this dryness is one of the main drivers of chronic itch, called pruritus, in later life. The itch is not just annoying, it disturbs sleep, reduces the quality of life, and drives scratching that can tear fragile skin even more. Texts on older skin care are very clear on the role of water and soap here. They recommend generous use of emollients, which are greasy moisturizers that lock water into the skin, and they warn against excessive bathing, especially with hot water and long soaking times. At the same time, aging affects blood pressure regulation and muscle strength. Standing in a hot shower can cause blood vessels to widen, which can drop blood pressure and increase the risk of dizziness or fainting. Wet, soapy surfaces are slippery. That combination of weaker muscles, slower reflexes, and low blood pressure makes falls in the bathroom one of the most dangerous events for older adults. This is why we cannot simply copy shower advice from a gym locker room and apply it to an 80-year-old body. The biology is different, the risks are different, so the bathing routine must be different. There is a strong myth that everyone needs a full shower every single day to be healthy and respectable, and that myth is especially hard for seniors and their families to ignore. Many older adults grew up in cultures where cleanliness was equated with daily bathing, even in times when hot water was hard to get. Family members may worry that less frequent showers mean neglect. Television and advertisements often repeat the idea that a daily body wash is the only acceptable standard. However, clinical experience and geriatric texts tell a more nuanced story. For older skin that is already dry, daily hot showers with foaming soaps can worsen itching and damage the skin barrier. This can set off a cycle where the person scratches, breaks the skin, and then faces infections that require antibiotics. In some studies on itch in older people, authors advise patients to avoid excessive bathing, to stay away from hot water and long baths, and to use soap substitutes and bath oils rather than harsh cleansers. So the myth is that more showers always mean better health and better hygiene. The truth is that for many seniors, more showers can mean more dryness, more itch, more skin tears, and more risk of falling. Cleanliness still matters, but it must be redefined in a way that fits aging skin and aging balance. If you care for an older parent or grandparent, share in the comments what their current bathing pattern looks like. Many families are surprised when they compare routines. Your experience can help others see that there are many normal patterns, not just daily showers. The honest answer to how often seniors should shower is that it depends, but we can build a clear framework that fits most real lives. First, we need to separate two ideas that often get blended together. One idea is a full-body bath or shower, where most of the skin is soaked and washed. The other idea is targeted washing of key areas that collect sweat and bacteria, such as the face, armpits, groin, and feet, along with cleaning after any episode of incontinence. For many healthy older adults who live at home are not very sweaty and do not have heavy outdoor jobs. A full-body shower 2 or 3 times a week is often enough to keep the skin clean as long as there is daily targeted washing of those key areas. Between those showers, a warm, damp washcloth can be used to clean the face, underarms, groin, skin folds, and feet. Hands are washed more often throughout the day, especially after using the toilet and before eating. For frail or very dry-skinned seniors, some clinicians recommend even fewer full baths, perhaps once a week, with more frequent gentle sponge baths to freshen the body without long exposure to water and soap. The exact number depends on comfort, odor, skin condition, and cultural expectations, but it is guided by the goal of protecting the skin barrier rather than stripping it every day. On the other hand, seniors who sweat heavily, who exercise intensely, or who live in hot, humid climates may benefit from more frequent body washing, but even in those situations, the focus should be on short, lukewarm showers and gentle cleansers rather than long, hot baths. Those with incontinence may not need more frequent showers, but they do need prompt and thorough cleaning of the perineal area after accidents, using pH-balanced cleansers designed for sensitive skin. So a more honest way to phrase the question is this: how often does this particular senior need a full-body bath or shower, and how can we ensure daily cleaning of key areas without damaging the skin or increasing the risk of falls? To make this practical, let us walk through different common situations and what a healthy bathing rhythm can look like in each one. For a generally healthy, independent older adult who spends most of the day indoors, walks regularly, but does not do heavy physical work, a reasonable pattern is a full shower or bath 2 or 3 times per week. The water should be warm, not hot, and showers should be short, often around 5 to 10 minutes rather than long soaks. On days without a full body wash, a warm cloth can be used in the bathroom or by the sink to clean the face, neck, underarms, groin, and feet, and to wipe any skin folds that tend to sweat. For a frail senior with very dry, itchy skin and a history of eczema or astiotic dermatitis, even that schedule may be too much. In those cases, a weekly full bath or shower, paired with daily gentle sponge baths, is often kinder to the skin. After each wash, a thick, greasy moisturizer is applied over the whole body, especially the legs and arms, to trap moisture. This approach lines up with geriatric guidance that emphasizes emollients and advises people with itch to avoid excessive bathing, hot water, and prolonged soaking. For a senior living with dementia, bathing can become a source of fear or agitation. Here, emotional comfort may matter more than strict timetables. Some people do much better with shorter, more frequent sponge baths instead of full showers. Others tolerate showers if they are scheduled at a time of day when the person is usually calmer, the bathroom is warm, and a familiar caregiver talks them through each step. The goal is dignity and cleanliness, not forcing a fixed number of showers per week. For someone with incontinence of urine or stool, the priority is quick, gentle cleaning of the soiled area after every episode, with products that protect the skin and preserve its natural oils. Full-body showers can still follow the same rhythm as a non-incontinent senior, but perineal care will happen more often. Barrier creams around the buttocks and groin can help prevent moisture damage and rashes. For a very active older adult who hikes, gardens extensively, or goes to the gym, the pattern may be closer to that of a younger adult, but the same rules about water temperature, soap choice, and moisturizing still apply. These seniors may shower more often, but they should still avoid long, hot water exposure and harsh scrubbing, and they should always follow with moisturizer. Listening to body signals helps. If the skin looks red, flaky, or cracked, if itching is waking the person at night, or if there are frequent skin infections, that is a sign that the bathing routine, the products used, or both need to change. Now that we have a sense of how often, we need to talk about how, because the way seniors shower is often more important than the count. Aging skin needs gentle handling. A good senior shower routine protects the skin, reduces the risk of falls, and leaves the person comfortable rather than chilled or exhausted. Preparation starts outside the shower. The bathroom should be warm enough so that the older adult does not shiver when undressed. There should be bright, even lighting so that water and soap are easy to see. Non-slip mats belong both inside and just outside the shower. Grab bars fixed securely into the wall, not just suction cups, should be placed where hands naturally reach. A sturdy shower chair or bench allows the person to sit while washing, which reduces fatigue and risk of fainting. A handheld shower head makes it easier to control water flow and avoid spraying directly into the face. Before turning on the water, the senior or caregiver can lay out towels, clean clothing, and moisturizer within easy reach. Water temperature should be checked with the inner forearm rather than the palm, because older hands can lose some sensation. The water should feel comfortably warm, not hot. Long, steaming showers may feel pleasant in the moment, but they pull moisture out of the skin and can widen blood vessels, dropping blood pressure. Once in the shower, it is rarely necessary to lather the entire body with soap. Cleansers can be focused on areas that actually need them, such as underarms, groin, buttocks, feet, and any skin folds that are prone to sweat. The rest of the body can simply be rinsed with water. This is especially important for older skin that is already dry. In line with geriatric skin guidance, soap substitutes or mild, fragrance-free cleansers are preferred over strong deodorant soaps or products that create a heavy foam. Harsh scrubbing with rough cloths or brushes should be avoided. Soft cloths or even just clean hands are enough. Hair does not always need washing with every shower. Many older adults do well with hair washing once or twice a week, depending on oiliness and style. After rinsing, the person should move slowly when stepping out of the shower. Sitting on a shower seat or a closed toilet lid to dry off can reduce dizziness. The towel should be used to gently pat the skin dry rather than rub it. Rubbing can irritate already fragile skin. Special attention should be paid to drying between toes, under the breasts, and in skin folds to prevent fungal infections. Within a few minutes of drying, while the skin is still slightly damp, a generous layer of moisturizer should be applied. Geriatric skin studies often point out that grazier preparations are the best for locking in moisture. Creams and ointments that contain ingredients like soft paraffin or urea are often recommended for scaly, dry skin in older adults. The goal is not a small dot of lotion rubbed in until it disappears, but a visible film that gradually soaks in. This routine takes a little planning, but it turns a simple shower into a treatment for dry, aging skin instead of an assault. Because the bathroom is also a common place for accidents, senior shower routines must include safety checks, especially for dizziness and falls. Heart disease, blood pressure medicines, diabetes, and neurological conditions all increase the risk that a senior could feel faint when moving from lying to standing or from warm water to cooler air. This sudden drop in blood pressure is called postural hypotension. When it happens in a wet, slippery environment, the chance of a dangerous fall rises sharply. To reduce this risk, seniors should stand up from a chair or bed slowly, pausing at the edge before walking to the bathroom. Some clinicians suggest that older adults sit during most of the shower, especially if they are on multiple medications that affect blood pressure. A shower chair and handheld shower are practical tools here, not signs of weakness. Footwear matters too. Bare feet on a shower floor may slip easily. Non-slip shower sandals or textured mat surfaces provide better grip. Loose bath mats that slide on tile should be replaced or secured. Medications that cause drowsiness or dizziness, such as certain sleep tablets, painkillers, or anxiety medicines, can be especially risky around bath time. For many people, it is safer to shower at a time of day when the effect of a medicine is lower and when another person is nearby in case help is needed. If a senior has already fallen in the bathroom, or if they feel wobbly during showers, this is not just a personal problem. It is a medical signal. The doctor should review blood pressure standing and lying down, check medications, and consider whether physical therapy to improve strength and balance would help. Bathing frequency may need to be adjusted, but so should the whole mobility and safety plan. If you have seen a loved one struggle with balance in the bathroom, and you are comfortable sharing, describe in the comments one adjustment that helped, such as a grab bar or a shower chair. Small details from real homes often help other families more than any textbook. The skin of seniors with chronic itch or skin conditions needs an even more careful approach to bathing frequency and technique. Older adults with long-standing itch, eczema, or very dry skin are exactly the people who can be harmed the most by frequent, hot showers and strong soaps. The sections on pruritus in geriatric skin references emphasis several core measures that line up closely with a gentle bathing schedule. They advise generous, regular use of emollients, which are thick moisturizers that seal in water. These products often work best when applied repeatedly throughout the day, not only after bathing. For scaly, dry skin, creams that contain urea can be especially useful because they help soften the outer skin layer and allow moisture to penetrate. At the same time, these studies warn older patients to avoid excessive bathing and to avoid hot water and prolonged soaking. They suggest using emollient bath additives and soap substitutes instead of ordinary soap, and they discourage long, hot baths that strip lipid from the skin. The message is clear. For dry, itchy skin in older people, more water and more soap do not bring more relief. Instead, they can deepen the problem. For seniors in this group, shower frequency might be as low as once a week for full-body washing, provided that daily targeted cleaning is still done for hygiene. The focus shifts toward moisturizing, avoiding triggers like very hot water, scratchy clothing, and harsh detergents, and treating underlying causes such as iron deficiency, liver disease, or thyroid problems when present. In any older adult with new or severe itch, unexplained rashes, or rapidly changing skin spots, it is important to seek a medical evaluation. Sometimes an itch is a sign of systemic disease, such as kidney or liver problems, thyroid disorders, or blood conditions. The solution in those cases is not simply to adjust shower frequency, but to diagnose and treat the underlying condition. Bathing routines must also respect dignity and mental health, especially when cognitive change or depression is present. Some seniors begin to avoid bathing not because of skin comfort, but because of fear, sadness, or confusion. A person with dementia may not recognize the bathroom, may feel exposed and cold, or may misinterpret the help of a caregiver as a threat. A person with depression may feel so low in energy and motivation that bathing feels overwhelming. In these situations, forcing a strict schedule such as a daily shower can lead to conflict, resistance, and shame. A gentler approach may be needed that can include shorter baths, music, warm lighting, favorite towels, or familiar scents that calm the person. It may mean accepting a pattern of one full shower a week plus several partial sponge baths, as long as key areas stay clean and skin stays healthy. Caregivers often need support here. Occupational therapists and nurses sometimes help families design bathing routines that match the preferences and abilities of a person. Equipment like shower chairs, handheld showers, and bath boards can make the task feel safer. Clear communication, such as explaining each step slowly and asking for permission before touching, preserves dignity. Respecting mental health also means noticing when changes in bathing habits are a sign of bigger problems. A once neat, careful person who suddenly stops caring for hygiene may be developing depression or cognitive decline. In that case, the bathing pattern is a clue, not just a choice. Bringing that change to the attention of a doctor allows for wider assessment and support. Putting all of this together, we can answer our original question in a way that is both simple and honest. The shocking truth about how often seniors should shower is that most older adults do not need a full-body shower every day to stay healthy. In fact, for many of them, daily showers with hot water and strong soap are a recipe for dry, cracked, itchy skin and an added risk of falls. For a large share of seniors, an approach like this works well. Most days, they perform targeted washing of the face, underarms, groin, feet, and any soiled areas using warm water and a gentle cleanser. After every wash, they apply moisturizer to the limbs and trunk. 2 or 3 days per week, or sometimes once a week for very dry or frail individuals, they take a short, warm shower or bath using a mild cleanser only where needed. They use safety equipment such as grab bars and a shower chair, they move slowly, and they moisturize generously afterward. People with high activity levels or living in hot climates may adjust this pattern upward slightly, while those with severe dryness, itch, or frailty may adjust downward, always balancing cleanliness with skin comfort and safety. Those with incontinence should add careful perineal cleaning after each episode, but do not always need extra full showers. Those with dementia or mood changes adapt the schedule to what is emotionally tolerable, supported by caregivers and clinicians. Most importantly, bathing is no longer treated as a fixed rule, but as a personalized health habit that responds to the realities of an aging body. Now, let us turn this knowledge into a concrete plan for you and for the seniors in your life. If you are an older adult yourself, start by observing your skin and your energy after bathing. Do you feel itchy, tight, or chilled afterward? Do you see fine cracks on your shins or arms? Do showers leave you dizzy, or do you worry about slipping? If the answer to any of these is yes, then your current routine may be too harsh. Over the next week, you can try 3 simple changes. First, reduce the water temperature so that it is warm but not hot. Second, shorten showers and reserve cleanser for the areas that need it most, rather than soaping every inch of skin. Third, apply a thick moisturizer within a few minutes of drying and keep using it on non-shower days as well. If you care for an older parent, spouse, or relative, sit down together and talk about how bathing feels for them now compared with earlier in life. Listen for signs of fear, cold, or fatigue. Look at the bathroom through their eyes. Are there safe places to hold on? Is there a seat available? Are towels and clothing ready so they are not standing wet and shivering? Then together agree on a bathing rhythm that feels safe and respectful. That might be a full shower every few days, plus daily sponge baths. It might be 1 main bath a week for someone with very dry skin. The key is that the pattern is intentional, not accidental, and that it protects both skin and safety. If you feel comfortable sharing, write in the comments one change you plan to make to your own shower routine or to the routine of someone you care for. It could be as simple as adding a non-slip mat or switching to a fragrance-free cleanser. These small steps are the building blocks of real prevention. In the end, the question of how often seniors should shower is really a question about how we respect the aging body. We can cling to rigid rules from youth and push older skin and fragile balance through daily hot showers in the name of cleanliness. Or we can look honestly at what geriatric medicine and real-life experience tell us and design routines that suit thinner skin, slower circulation, and changing energy. When you choose the second path, you are not lowering standards, you are raising them. You are saying that the goal is not to match a number of showers per week, but to keep skin healthy, confidence intact, and bones unbroken. You are saying that dignity and comfort matter as much as scent. Let this be the new identity. You are someone who understands that healthy aging includes smart bathing. You use water, soap, and moisturizer as tools, not as habits on autopilot. You adjust routines as bodies change. You ask questions and make choices that protect your future self and the older adults you love. If this video helped you see senior shower routines in a new way, subscribe so you stay close to future discussions about skincare, fall prevention, and everyday habits that quietly shape how we age.